competent sonographer's eye will tell you, if you go little far, then you will see, oh, it looks like there is something. There is something because it is a hyperplasia. Increased number of cells in here gives a little tightness, little changes of the echogenicity, but it is close to the liver too. Okay, it is isoechoic. Iso means same looking. Now this is another isoechoic. Look at here. This is a hemangioma in the liver here. But can you see this hemangioma? Is very tough because hemangioma is most of the time is brighter than the surrounding tissue. But it could be isoechoic. It could be hypoechoic. It could be complex looking. I saw those hemangioma. Okay, but most of the time hemangiomas are hyperechoic, well circumscribed, and usually it does not cause posterior shadow. Okay, so this is isoechoic, and now this is anechoic. Okay, so now this is in the uterus. I see there is an anechoic mass inside the uterus. This is totally anechoic, and there is an enhancement. Here in the kidney there is an anechoic, and this is anechoic in the sinus area, and there is enhancement and is refracting shadow. So this is anechoic, same as the cystic mass. I mean the simple cyst, there is an anechoic inside, so or sonolucent. Okay, so we understood hyperechoic, hypoechoic, isoechoic, and anechoic. The other names of anechoic is sonolucent, echo-free, okay, echo-free, or no echo. Okay, so next is a heterogeneous mass. Heterogeneous mass means not homogeneous. So now this is heterogeneous mass because it is not same all over, but it has a posterior enhancement. This is a heterogeneous mass with calcifications I see. Okay, it is in the thyroid gland. It is a heterogeneous thyroid mass. Okay, so now this is within the thyroid gland, and this is in the breast, heterogeneous mass. Okay, look at the differences. So this is homogeneous here, but this is heterogeneous. Now homogeneous mass. Look at here. This is an ovarian lipoma, and it's a very rare ovarian lipoma or anywhere. It is a lipoma. So lipoma is homogeneous. Okay, this is homogeneous. It's all over same. Here homogeneous mass in the right mid thyroid. Look at homogeneous mass. Okay, you have to train your eyes, no question about it. So this is homogeneous. You can see well circumscribed homogeneous mass, and texture is smooth, texture could be coarse. So this is homogeneous. Now solid tumor with necrosis. So necrosis means the cellular death. Now this is a mass, this is a ductal carcinoma with a central necrosis. Usually it is in the breast, intraductal invasive type of carcinoma. If you look carefully, there is a irregular borders. The necrosis started. Okay, and here there's a right kidney mass with a central necrosis, and you know the necrosis is a good sign. Why? Necrosis means the cellular death. Why there is a cellular tumor but there is a death of the cells? Because this tumor needs more nutrition, more energy, more oxygen, but it's not getting. the nutrition and oxygen. As a result, the tissues are dying. So this is very important findings, that necrosis is a good findings. If you do the treatment, chemotherapy or vascular embolization, then if you see there's a necrosis, it is a good sign. That means this tumor will be dying and regressing in size, so it is a good sign. Okay, so this is necrosis. Now this is calcified. Calcifications with the posterior shadow. This is a posterior shadow, posterior shadow. So this is a calcification, calcification in the border, in the periphery, calcification in the center. Okay, so not all the time calcifications are good, calcifications are bad. I saw so many benign tumor with calcifications. There is no problem. But calcification is also a precancerous. So calcification is a precancerous. It is a worrisome condition. So we need to understand that if the calcification, it has to be followed up closely, because it may turn into any form anytime. So it's better to remove it. If not, then follow up. And also keep that in mind. If it is a calcified mass in the breast, and you know the breast microcalcification is a precancerous. So if it is in the breast, I will not keep it. It is in the scrotum, right scrotum, there is a mass with calcifications. Okay, so any mass in the scrotum, means outside of the testis if it is, so then it is not that much worrisome. But I will tell you, if it is within the testicles, then I will say any intratesticular mass is cancerous, malignant, unless otherwise proved. Here the calcified mass in the right lower abdomen. Okay, so this is a calcifications. Okay. Now wider versus taller. So now look at here, this is in the breast, I know that. So this is in the breast, it's a node, it's a fibronodular, fibronodular mass, and that means it is oval shaped and it is more flat than tall. So we call it fibroadenoma. Okay, fibroadenoma usually like that with a smooth borders, hypoechoic, it's oval shaped. And some fibroadenoma has enhancement. And now here you can see this mass is taller than wider. So it is a breast nodule, but it is taller. Most of the time in the breast, the taller mass is malignant. Okay, but still you need to do the biopsy. Look at here, the borders are irregular, right? And the tissue distortion is started, and it is hypoechoic. Okay, so now I will consider as a malignant unless otherwise proved. We need to do the biopsy. Okay, so now it is taller than wider, and this is wider than taller. So this wide than taller goes with the benign most of the time, and the taller than wider goes with the malignancy. So now coarseness. Okay, the texture. Coarse means rough. So now look at the liver. It's look like liver is definitely, it is brighter, and the liver is little more rough. Little more rough. Look at the liver, little rough, and this is a cirrhotic patient. If you look carefully, this is a regenerative nodule, and the hardening and fibrotic liver, shrinking liver with ascites. Look at here, this is ascites. This is coarseness of the liver. Liver is coarse. This is also indication of the cirrhotic. Look at the hepatic veins are not clearly seen. Coarse texture of the liver due to cirrhosis, and coarse texture of the liver due to hepatitis. So this is okay, chronic hepatitis, due to chronic hepatitis. So look at this liver, look at this liver. This is called coarseness. Okay, rough texture. Now smooth or fine. Look at this liver here. So nice, hypoechoic, then homogeneous, it's smooth texture of the right lobe of the liver. Here, look at the liver and the kidney. So nice view. So this is liver, homogeneous, and this is kidney cortex, and this is kidney sinus. This is called smooth texture. Okay, this is right kidney smooth texture. The cortex is smooth texture. Liver is smooth too. Okay, so that was actually right now my collection, and I tried to give you a lot of informations about the sonographic appearance of the organ, normal versus abnormal, and I hope you're gonna practice it in your daily job and practice life, and you will see if you practice in this way. So then one day, second day, third day, fourth day, then by just looking at the organs you can say, oh, it's a good looking or bad looking, and accordingly you can save lot of times and you can produce lot of quality images and diagnostic images, and your images will be high quality, optimum images, and nobody can argue with you. Okay, thank you very much. I hope you like it and you enjoy it. Okay, keep on watching. I will upload more and more video. Okay, thank you so much for watching.